Well, hello, I'm Dr. Lauren Nations, and thank you for watching this short little video. I wanted to give you an update on some events that Veterinary Healthcare Associates is presenting to our local veterinary community. We're going to have and host a hour-long dinner meeting for you, basically to let you peek behind the curtain of Veterinary Healthcare Associates. We've got a couple different programs that we're interested and excited to roll out specifically for our veterinary community that hopefully help you and your clients and patients receive advanced care in a timely manner. And I think it's important to understand, for those of you who have been on this journey with me over these years and decades, or newer practices that may have heard of us or haven't heard of Veterinary Healthcare Associates, as to what we're doing and why we're here. I graduated in 1991, so I've been practicing for a long time. And as a young veterinarian, I had a very, very strong burning desire to create a veterinary center that would be a referral specialty center, or at least offer advanced diagnostic images and emergency care that I had seen after my internship at the Animal Medical Center in New York City in 1991. Back in the day, Winter Haven, Florida, and Central Florida, quite honestly, was just a sleepy little orange grove area in the center of Florida. I remember thinking of it as nothing but orange groves and fire ants and heat. And nowadays, look at us. We're the fastest growing county in the country, and certainly in the state of Florida, and we've seen the population explode. With that, there's also been a lot of change in the veterinary profession. And so corporate entities have come in and they've shifted the dynamic of how we do everything. All along this path, my focus has always been true to the principles of veterinary services, compassion, and relationship based. And through that, we have grown. We've grown fast. Sometimes we've grown well. Sometimes I feel like we've occasionally grown a little tumor that we'd have to surgically remove and evolve our practice. And so on this path, though, the mission of being here for our referring veterinary community, the pet parents, and the patients that you guys see, that is our true purpose. So in that, one of the things that we've experienced, we built our referral specialty practice up quite a bit. We have a building we call it VHA 1.0, which we opened in 2008. I didn't ever think I was going to build another building. I thought I was going to die in that place. Not the case. We ended up building our expansion that opened in June of 2024 last year, 23 last year, I'm sorry. So we've been in almost a year. And it's quite an incredible facility. That being said, it's the people within the facility and the things that we've done that are important for our veterinary community. So that being said, part of the meeting, there'll be a little bit of an update. I want to give you some of the updates on all of our trials and tribulations, where we are. Our emergency services have grown, and we want to make sure we're doing a good job for you in that capacity. But there are 3 programs that I want to highlight specifically in these dinner presentations. The first one is hyperbaric oxygen therapy. For those of you who have sent things to VHA, we use hyperbaric quite frequently, and there are some really unbelievable benefits in healing and in treating both acute and chronic diseases. The problem and the difficulty in veterinary medicine is that there was only 67 hyperbaric chambers in the nation. So general practitioners, those that don't have chambers, which is everyone except for a very select few oddballs, us being included, don't have access to that therapy. What we are doing is we are developing a hyperbaric referral program that does not need to see a veterinarian specifically with an appointment for you to prescribe it. You will be given information on how to use it in some of those cases. Certainly we're involved if that's something that you would desire. That's not a problem, but you can actually utilize this healing modality for those cases you're already managing, but would like to maybe have a leg up and have some advanced healing like hyperbaric. So we're going to go over a quick little presentation on hyperbaric, nuts and bolts, all that, roll out the entire program for you so you can get an idea of how you could potentially utilize hyperbaric oxygen in your practices without having to go out and get one. So that's number one. Number two is we have a surgical center. We have 2 boarded surgeons. Dr. Katie Berry loves soft tissue surgery, and she's very passionate. Her favorite surgery, which is going to be good news to you, is Boas surgery. It's brachycephalic obstructive airway syndrome, otherwise known as Frenchie disease. And so with that, Frenchies being the #1 breed in America at this time, I think that it's very appropriate that she's specializing, and we've put together a package and a program that you can use for your Frenchie, your brachycephalics, all of our little squash-faced beasts that get hyperthermic just from going out and chasing a ball for 5 minutes. So she'll go over that program, and we'll give you information on referrals and whatnot for Boas procedures. The third area is one that I'm extremely excited about, and I think that this is going to be a great benefit for everybody in practice that don't have this equipment, and this is what we call our Advanced Diagnostic Imaging Center. So again, this is based on some human models, and really it's designed to allow you as a practitioner to utilize MRI, advanced diagnostic imaging, CT scans, and even ultrasounds on a prescription basis or an outpatient basis for your clients. And so we've got this program set up. I'll go through all of the components of that you can see how to utilize that in your practices if you don't have time or if you're not able to provide those. Obviously, I know it's difficult on referral because sometimes there's a 4 to 6 to 8 week waiting time to be able to get in for some of these imaging modalities, and we need answers faster. This is an attempt to try and help minimize or decrease costs so it makes it affordable, gets us the data and the information in a timely way that you can use it for your cases in that way. As an add-on, we are also leveraging technology and have the ability to do telespecialty consults in conjunction with those appointments. I'll dive into that a little bit more as we get into the meat and potatoes of the program in the presentations. That being said, there are 3 presentations that are being offered. The first presentation is these are the end of August, August 19th. The first one's going to be to our Lakeland community. The second one is on Wednesday the 21st. That's going to be down in our Sebring area. And then the third one is the 22nd. That's going to be offered in Celebration. Please sign up. There'll be information for you. This is a free event. It's a VHA event. It's being sponsored by Vet's Choice, who is a preferred provider of our hospital for radiology, telemedicine reads. So they've been gracious in helping get the message out for the Advanced Diagnostic Imaging Center, our hyperbaric services, as well as the Boas surgery procedures by Dr. Berry. So with that, I thank you for your time. I look forward to seeing you one of those dates. If you have questions or concerns, please reach out. We're willing to help. We're here for you. We've been here for the veterinary community for the last 30 years, and I'll continue to do that as long as I am practicing, which will probably be forever. So thanks so much, and look forward to seeing you.